We only have about 4 minutes left with Dr. Aronoff, so I want to quickly bring in Renee with her comment or question. Renee, go ahead. Renee, you still with us?
Yes, I'm still with you.
Okay, can you go ahead and ask your question or make your comment?
Okay, Doc, I want to ask a question. If you have cirrhosis of the liver, and I was wondering if you get the COVID-19 or get the vaccine, will it drop your liver enzymes, or will it higher your enzymes, or will it be a danger to the effect of your liver enzymes?
Thank you for the question, Renee.
Yeah, Renee, that's a really great question. So the natural infection with SARS-CoV-2, getting actual COVID-19, can absolutely cause what we call hepatitis or damage to the liver. The vaccines do not cause damage to the liver. They will not make your liver enzyme numbers abnormal. So that's an important distinction, and I'm glad that you asked that question. Thank you, Renee.
And I think she brings up a great point, Dr. Aronoff, that, a lot of some people's concerns about the vaccine end up being sometimes bigger concerns that the virus could cause. So as we kind of wrap up our time here with us, what would be kind of your pitch to Middle Tennesseans that may be a little hesitant about getting vaccinated?
Yeah, I mean, I think the biggest pitch is that we're just about closing in on 3 million people worldwide that have died from COVID-19. We're closing in on 600,000 people in America. So far, we've seen over 12,000 lives lost in our state alone from COVID-19, and our businesses are still paralyzed. Our economy is still paralyzed. We need this pandemic behind us, and we need to do that by building a shield of immunity that stops this virus in its tracks. And we can each play such an important role in that. We may not think our individual role is important, but if you get vaccinated, not only are you making it really hard for you to get infected, and if you do get infected, you're so unlikely to get seriously ill or die. That's an important reason to get vaccinated, but also you're going to be part of putting a stick in the spokes of this cycle of the virus going from one person to another to another. You can be part of the solution. And I think it's really a time where we all have to step up and be leaders and end this pandemic together. So I hope if you're watching that helps. And it's certainly an honor to be on here tonight with Chris to get to talk with you.
Dr. Aronoff, we have about a minute left. So I'm curious if, let's say somebody's watching tonight and they're quite confident that they want to get vaccinated, but they have a relative that is a little on the fence. What resources out there could you direct people to if they're wanting to know more about this?
Sure, lots of good information. I mean, there's lots of great information on the CDC website that's very patient-friendly, person-friendly, not written for nerds like me, but written for the general public. I think that's a great source of information. The Tennessee Department of Health has excellent information that's very easy to understand. Local media outlets like yours also have really helpful information, Chris, that people can click on. It's not hard to find COVID-19 information. And of course, on websites for local hospitals and healthcare systems, including Vanderbilt, but all sorts of healthcare systems have great information for patients on where to go to get tested or diagnosed or treated.
Well, we are so lucky to have great minds like Dr. Aronoff in our community and here to answer your questions. A few final thoughts after the break.